Hi, I'm Dr. Richard Eby of Eby Foot Care and Laser Center in Chattanooga, Tennessee. And today we're going to talk a little bit about office foot surgery, the tools of the trade. Specifically, we're going to talk about power surgical equipment. So first of all, surgery on the foot can usually be done in an office-based setting if a well-equipped office OR is available. Today we're going to limit our discussion primarily to surgical power equipment used basically on bone surgery of the foot. So let's come into the surgery room and let's look at a couple of x-rays first just to see what kind of deformities we might be talking about. I'm going to just briefly talk about a bunion deformity and then we'll look at some of the equipment used to correct that deformity. We see two x-rays here. On the right, kind of a mild to moderate bunion or hallux valgus deformity. And that's when the big toe is crooked, leaning to the side. First metatarsal bone is pushed out, and the bunion is this large bump. On the left, a much more severe bunion deformity. Here, the metatarsal is very deviated. The toe is going so far to the side that the second toe is actually dislocated and sitting up on top of the big toe. And while this is certainly a lot more challenging deformity to correct than that one, both of these can be corrected using surgery. Surgery in the foot is often local anesthetic, whether it's done in an office, surgery center, or hospital. Sedation can also be done with it. And on a future video, we're going to talk a little bit more about implants, screws, things like that that are put in. Today, I just basically want to orient people to power surgical equipment, things that are used to cut bone, to put bones together, that run either on electric or on gas, in this case nitrogen. So just a couple pieces of equipment that are used. This is one case where an electric device, this one is made by Stryker, and we have a situation here right now, the drill isn't in here. And by the way, these would all be sterile during the surgery. This would be sterile, the cord would be sterile, I would be gowned and gloved, just to give you an idea of what we're talking about. So in a case like this, we have a piece of equipment that can be, the setting can be changed from slow to fast. It's on safety right now. And you can hear, and again, there's no drill in there right now, but just kind of gives you an idea of what we're talking about. A drill would be used to make holes in the bone, possibly to put in metal suture or what's called monofilament wire. It can also be used in minimal incision surgery to smooth down a bump or an extra bone. Moving over here, we have a few other pieces of equipment. This is a K-wire driver, and this is a K-wire. So this is used if, for example, we were to cut a bone, like a bunion, move the bone over and try to put the two pieces together. Again, this can be used, and this is actually a pneumatic or gas system, which I'm going to show you here in just a minute. But that's a K-wire driver. In fact, we'll put that on. I do want to show you, first of all, what a power sagittal, this is an oscillating saw, power oscillating saw looks like. Again, this would all be sterile during the surgery. This is the actual saw. That's the saw blade. And as you can see, when I push the handle, very easy finger control. Now this can be changed. I go back here to the nitrogen tank. And what I can do is change it to the wire driver. So if we were going to cut a metatarsal bone to take care of a bunion deformity, we would be using the saw. And then to put the bones back together again, we'd be using what's called a wire driver. And again, be talking about something like that. So what this basically does is put two bones together so that they'll fuse in a corrected position. Again, that's a K-wire driver. This one is made by Zimmer or Hall. A little older unit, a little more power than what you get with electric equipment. One final thing I'm going to show you, which again, the staples are not loaded in this, is something called a stabilizer. This is a unit where you're taking two bones, you're cutting the bone, and you want to put them together and put a staple in them. Very quick and convenient. This thing is also powered by air, by nitrogen, and wherever the bone is, this would be put on it, and just looks like a staple, just a lot bigger than the kind of staple you're used to putting in paper. A lot more things I can show you. Some of them we'll talk about in a future video. We'll talk about screws, a little bit more about wires, plates, but just to give you an idea what's needed for bone surgery, and again, soft tissue surgery as well, in an office setting. This is important because not only is it more convenient for the patient, it's often a lot less expensive. Whether you're doing a surgery center or hospital, charges really add up for anesthesia, for the use of the OR, for all the equipment used. In office-based setting, all of this is included in the surgical fee. So just wanted to go over some of these things with you. We'll talk a little bit again about this in a future video. I'm Dr. Richard Eby, Eby Foot Care and Laser Center, Chattanooga, Tennessee, www.rebfootcare.com.